We always say feedback is the breakfast of the champions.
You are a researcher, you're an educator, you are a great clinician. You are genuinely very curious. You're the most curious person I probably know. So why is this? Why are you so curious?
We are egocentric as humans. The first thing about listening or about curiosity is if you want to create good feelings in someone else, you have to listen to them. Try to understand people who are around you. I want to learn from the best of the best, get a kind of best practice for all of my 5F, and this can only happen with curiosity.
Welcome to ProTalk, welcome to the Pulse of Dentistry, welcome to this episode of our Inspiring Conversations. And today, George and myself are welcoming Professor Dr. Eik Schiegnitz. Welcome, Eik. It's a big pleasure to have you today from Germany. Eik, you are a maxillofacial surgeon by training. You are running the department for Implantology at the University of Mainz. Beyond this, you also studied health economics, and we come to this topic later. I'm curious what's behind this one. You are a researcher, you're an educator, you are a great clinician. You're very active in associations such as the ITI and the DGI to help them progress and to do kind of also a generation shift there. But beyond this, you also started your endeavor now running your own private practice just recently. So a lot going on in your life. We come to this later. Really a big pleasure to have you here, Eik. We know each other for a long time and are very close friends. So it's a pleasure to have you today. Yeah. Eik, for the ones that are not knowing you, who is Eik Schiegnitz in 1 minute?
Yeah, first, thanks for the kind introduction and for the invitation. I appreciate it a lot. Who is Eik Schiegnitz? It's quite easy. At the core, I'm someone who loves challenges. I try to challenge my status quo every day. Whether it's complex bone regeneration, whether it's a new fancy immediate protocols, my favorite clinical topics, or if it's running an Ironman or being a father of 2 great childs, for me it's about growth, it's about purpose. But very important, it's not for pushing harder for the sake of pushing. For me, it's important to have harmony in my complete life. So I have defined 5 pillars for a fulfilled life for myself. It's my 5F. It's the first F is the most important. It's family and friends. It's my close relationships. The second F is fitness. So it's all about regeneration. It's about sports, about nutrition. The third F is about the firm. So my business. I'm a clinician, leader of a department and a business owner. So I want to push harder in this firm thing. The fourth F is about finance. Of course, we all want to have financial freedom, topic for itself. And the fifth F is about fueling the mind. So progress, learning, long life learning presence. And for me, it's very important to be excellent in every of this 5F. But to have harmony between these 5 Fs. Not to be the super clinician, but who has no family or who is not fit. I want to have harmony in all of these 5 Fs. So at the end, at the core, I'm a passionate oral maxillofacial surgeon. I go to work every day with a big smile. But I'm also a passionate family father, a passionate sportsman, a passionate educator. For me, it's a holistic approach to my happiness in life.
Wow. Sounds very inspiring, like and we come to this, and I think I take one question forward that I always wanted to ask you, because we know each other a long time, and there are not many people that ask so many questions. I mean, you are genuinely very curious. You're the most curious person I probably know. So why is this? Why are you so curious?
I have learned we have 2 ears, but only 1 mouth. Yeah, most of us want to get a message to the person who is next to one because they want to get a better feeling of their life. We are egocentric as human, and The first thing about listening or about curiosity is if you want to create good feelings in someone else, you have to listen to them. Don't get your own message inside the other person. Get his message to you. Try to understand people who are around you. And if you understand them, you know their problems, you know where you can improve them or get impact for them. So for me, it's all about listening, proactive listening, understanding the person who is next to you. This is the one case. And I'm from the heart someone who learns very, very happily, or who is a big learner. And you only learn with smart questions. So if I'm at a congress or at a business meeting or just in a private setting, I always look in the room and look for the person who I think is the most impressive, the most inspiring. And then I try to approach this person and try to understand this person. Why is he or she so successful? To get impact for my own life. And I talked about the 5F, the 5 pillars of my life. And of course, I have mentors or inspiring people for every F. So you have to learn a lot, or you have to meet a lot of great people to have the best benchmark for every F. So this is my curiosity coming from. I want to learn from the best of the best, get a kind of best practice for all of my 5F, and this can only happen with curiosity.
No, it's great to hear, and it's exactly how I experience it. I think it helps you to fuel relations, because people relate much better to you. But also, of course, it fuels your progress. And I think curiosity is the starting of learning. And, learning is the start of progress. And as you said before, progress is probably the start of happiness at one point. So that's a question I always wanted to ask you. You're not only a dentist, you're a maxillofacial surgeon. So you, at one point in your career, you had to decide not to pursue dentistry, but to go a step beyond and also do a medical degree. Why was that? How did this go?
Yeah, well, I didn't just want to treat teeth. I wanted to understand, learn the whole system, the whole body. And there, this fusion of dentistry and medicine and oral maxillofacial surgery was for me like a calling. I thought, wow, that's the big thing. I can be a very focused specialist on treating tooth or treating implants, but can see the whole body. And I think on congresses today, we focus very much only on the tooth or only on the implant, and we forget that on this tooth is hanging a whole patient. And so we have to see at the beginning always the whole patient. And this is oral maxillofacial surgery for me about. So this dual expertise still shapes my everyday diagnosis, my everyday treatment. So I want to always have a holistic approach of my patient, and therefore I choose oral maxillofacial surgery. And of course, it's a great specialty where you can do research, you can go into university, you can go into private practice. You have a huge possibilities in oral maxillofacial. Probably the best specialty in surgery, if you want to have all the options open.
Yeah, I almost see it like a continuum, you being, a dentist, a maxillofacial surgeon, down to your sports career, because you also talk a lot about longevity and health, and you will have later a lecture here in the house speaking about longevity, right? So I think that there seems to be a continuum which is not breaking anywhere. It's very complete.
Maybe to build on this, so how do you see the current dental field actually looking at general health? Because there is a lot of know-how and knowledge that actually this is closely linked, and oral health has a big impact on general health, but it is not general practice.
Absolutely. It's still in the niche. We have to get it on the big congresses. We have to do the big lectures about the whole patient. But the colleagues don't want to listen to these lectures. We always try to implement them, but at the end they want to have the special lecture on a fancy surgery technique. So we have to begin with ourselves. We as a clinician have to start with this mindset. I want to understand my whole patient and then go into detail. But this mindset is not enough implemented in the minds of our colleagues. So we have to start to get this mindset into our colleagues. Everybody has to start first at his own private practice to see a more holistic approach.
Then there's something else which is very special. You studied health economics. What is this, and why did you decide to embark on this journey?
Yeah. At the end, we all want to be specialists or we want to have clinical excellence, but this does not exist in a vacuum. We always have to see the broader context. And I wanted to understand the system, how it works, how is resource allocament, where comes the money from, where does the money go? And if you want to be a good leader in your private practice, if you want to be a good leader in a department, if you want to get a more strategic mindset in your younger colleagues, you have to see the whole system. And of course, everybody says, I don't get enough money. Everybody is complaining now in Germany about too less money in the dental system, but then you have to understand where is the money coming from? Who is paying for this? We all pay for this. So you always have to see the broader context, and there helps health economics to see both sides. We as a clinician, and of course the side who is paying the bill at the end. And I think it's totally necessary, and it should be implemented in dentistry studies already, but that's not the case, and I think that's a big mistake. We have to much earlier think about these broader context. How do we finance health in the future? We will all have a big problem in the future financing our health system. And we have to think ourselves about it. How can we get our part to make our health system more sustainable?
Make it work. So how long was this study? Was it like an MBA for 1 year or a full study for 4 years? How was that?
Yeah, in Germany we have the Betriebswirt. It's a kind of MBA. It's a 3-year studies, and you get in touch with every player in the health system, with the insurance, with the state, with the private practice, with the clinicians, and you see every side and every advantage and disadvantages when you do this in a kind of health setting or that. So you get a broader context. That's all about it.
So it was like 3 years in parallel to you working and preparing for Ironmans and stuff. Okay.
Being on the cross trainer.
So how do you benefit from this today?
A lot. Every day. Yeah. Because I already told you, or you see it yourself, that everybody is complaining. I think a smart human doesn't complain. Yeah. Why complain? Because complaints doesn't make the world better. Yeah? You always have to think about it. How can I make a difference in the world? How can I make the world a little bit better, or the patient's treatment a little bit better? And this health economics helps you that you are not alone, a lonesome player in the world. You are mini part of the big system. Yeah? And it doesn't help to complain. So you have to see, how can I survive, or how can I improve my clinical setting, regardless of the university or private practice setting. How can I make my department safe so that the employers come there with joy, and that they can I pay them safely? Yeah? And this is today only possible if you talk about private patients paying private bills. Yeah? And this is a mindset change in Germany. Yeah? But without this mindset change, our system will get in flames. Yeah.
You're really the prototype player learner, as we call it, the concept that we use in our cultural language a lot, so really leading from above the line and focusing on what you can influence and on the positive things. And I think it really makes a difference in life, not only in business, Absolutely. But also privately. Let's stay a little bit longer on your, let's say, business journey. If you look back in your journey, what has been a moment where you would say that this was really influential for you, or a person that influenced you as I looked at this was really the changing tipping point in my career?
Yeah. During my school days, I had very non-inspiring and boring teachers. I hated my school time. I think it's a man problem, especially. Women are smarter. They also already see in school times that it has a broader goal. This school time, for me, it was just boring. I hated it. Then I started studying medicine, and then I heard inspiring, very, very inspiring lectures by my later mentors, Professor Anoas and Professor Wagner. And from this inspiring lectures on, I was mentally on fire. First, I deep dived into the learning journey, how to become inspiring like my mentors, and then how to educate others. So it started becoming a better surgeon for myself, and then how to get others being better surgeons. So these lectures from Professor Wagner and Professor Alnos, these were absolute game changers for me. In school times, I were absolutely afraid to talk in front of an audience. I was the totally shy guy. Yeah? Okay. It completely changed thanks to Professor Wagner and Professor Alnos.
Thanks to the inspiration they gave you.
Mm-hmm. Yeah. Because you can create impact. Yeah? My purpose is to create impact in a business context. Yeah? In myself, it's not about money. I don't care about money. I care about impact. Yeah? I want to get my employees getting better and better. I want to get my child to be open-minded, to be happy persons in the world. And it's for me, it's about creating impact. And you only can create impact if you are inspiring, leading as an example, and if you can educate others. And this was for me the game changer, to understand this, that if you want to be an inspiring person, you have to learn education.
Okay. Can we dive into this a little bit deeper? So why is this? Because, you know, we kind of take it for granted, but it's not. I mean, you could just be a great clinician, you know, treating patients every day, and have a happy life in your clinic or in the university clinic or your private practice, and you would be already very busy. But you decided to be an educator and a mentor, and I think that's I see you on many stages, spending a lot of time and investing a lot of time, free time actually, in associations and helping also younger clinicians to grow. Why is this? Why did you decide to do this?
Yeah, at the end, you have to know what is your purpose in life. It sounds very philosophically, but I think it's very important to understand your bigger purpose. Yeah? For some, it's about money. Yeah? They want to have this fancy lifestyle. For others, like me, it's more about impact. Yeah? And if you have understand your purpose deep in the heart, and I recommend to dive deeper into Ikigai. Yeah? It's a Japanese philosophy. There are 3 questions. What do you love? Yeah? What are you enthusiastic about? About which topic you can talk for hours and hours and don't get bored. So what do you love? Second question is, where are you good at? It's a difference. Mm-hmm. You can love something but be very bad at it. Yeah? So if you have to have 100% success in a task, what would it be like? Mm-hmm. Yeah? For me, it's doing something with my hands. I know I'm talented in doing surgery, but you have to know it and ask other people. Don't just ask yourself, ask other people, where do I have success in your mind? Mm-hmm. Yeah? So these 2 questions at the beginning, what do you love? Where are you good at? And if you answer this, these are 2 circles, and you have to have the combining things between these 2 circles, but with these 2, it's just passion. You cannot live with it. So the third question is, with what can you help the world? Yeah? Where is a business context in a kind of way in these things that you love and that you are good at? And if you have this area with where all these 3 points come together, you have found your purpose.
Your sweet spot.
And your sweet spot, yeah, wonderful word, your sweet spot. And if you have your sweet spot, for me it's impact generation, then you can do whatever you want, you will be fulfilled.
We have a community question following this from someone that you know. It's Andre Chen from Portugal. So thanks for providing the question, Andre. He knows you obviously quite well, and his question is, how do you balance your passion for outdoor sports and outdoor in general with your passion for dentistry?
Yeah, my mantra is progress equals happiness, how I told you. And in sports, it's just one of my 5 pillars. Yeah, and each pillar fuels the other pillar. Yeah, so I think it's not they don't
drain.
Yeah, they don't drain. So they are synergy. Yeah, I think if you have a fulfilled familiar pillar, yeah, it's much easier to be a peak performer in work, because at home it's happy, there is happy mood, happy life. Then you are much more relaxed going to work. Yeah? And if you feel fit, if you are well regenerated, if you have slept well, it's much easier for you to be a peak performer in the operating room or as an educator. So for me, it's all about synergy. Every pillar fuels the other, and therefore, I try to have harmony between these 5 pillars.
That makes sense, that they're not draining energy from each other, but they are fueling each other. But I mean, to be honest, to challenge this a bit, I mean, you could do fitness also, with running twice a week. I mean, based on science, this would be enough, but you do much more than this, Eik. You did a couple of Ironmans and also long distance. And I mean, those are really extreme situations mentally, but also physically, both. So what is it that you transfer from this, the toughest moments that you have there? I can imagine, doing the last part of it, running a marathon after already 2 other disciplines. There are some tough moments as well. What do you learn from this for, let's say, your professional career?
Yeah, I like your word, toughest moments. You have toughest moments in all areas of life. And they are normally in a sports kind of way. When your body says, no, but your mind still says, go. Yeah. And in these toughest moments, you really have to get mentally into a tunnel. You have to be very, very focused. And there again comes your why. Why are you doing an Ironman? Yeah? Are you doing it for your parents because they love you more, because then you are the famous sportsman? Are you doing this Ironman for yourself? Yeah? And I am doing it for myself. I like the moment going above the finishing line. Yeah? For me, that's dopamine, it's endorphins, it's just a beautiful feeling. Other people take drugs to get these feelings. I do a marathon, I do an Ironman or the training. Yeah? For me, it's my why. Yeah? I can't explain it. Why is Reinhold Messner going on a Mount Everest? He cannot explain. He says, because it's there, he always says. Yeah? Yeah? Everybody has his own strange things in mind, what he's curious about or what he wants to achieve. And that's what we already discussed. You have to find your why. And then these toughest moments, they become achievable. Mm-hmm. Yeah? Because when you have your bigger why, you have this good feeling in mind. When you get through these toughest moments, you will have endorphins. Mm. So you push through these endorphins. And especially in an Ironman, I think you have to respect the saying, how do you eat an elephant? Slice by slice. Mm. Yeah? Don't think about a marathon when you start the marathon. Think about the first kilometers, yeah, and then the next kilometers. And if it's getting hard after 30 kilometers, it's really getting hard. Don't think about a kilometer. Just think about a step. So I can do one step, and if I can do this step, I can do the next step too. So do it into small pieces. Every big task, and then you can achieve with the right mindset and the right purpose everything in the world. There are no limits for yourself.
I have to say, I'm very impressed by how mindful you are about yourself and your purpose and the why and how you build your life. So it's quite impressive and also inspiring, Eik. I wanted to ask you also about the environment you're working at the moment, the University of Mainz, knowing Bilal also quite well. I know it's a special place and from a leadership perspective, but there's also a lot of output. Mainz is one of the most productive universities in dentistry if it comes to really meaningful publications. In your point of view, what makes Mainz so special and so productive and a really great place to work?
Yeah, we foster a kind of striving for excellent culture. Yeah? So we prioritize smart questions over hierarchy. There is no this big boss who is standing on top of the game, the alpha male. No, we want to have a flat hierarchy. So from the student to the leading clinicians, it's about curiosity. We want to have smart questions and we want to get better every day. And what we learned, we are allowed to fail. My former boss, Professor Wagner, always gave us the right to try new things, although we knew not everything will work. Failure is part of the game. And in my biggest failures, I think I had the biggest learning presence. But you have to get feedback. Don't just do a mistake and do nothing. You have to reflect about your mistake. You have to recognize the mistake and then make conclusion out of this mistake. Yeah? And this is only possible if you have an inspiring setting. And in our university, there are so many smart guys. Mm-hmm. Yeah? So we can challenge each other every day and learn from each other. And we always say feedback is the breakfast of the champions. Yeah? Without feedback, you don't get better. So I take hundreds of pictures every day when I'm at the clinic, and I don't go to bed before I have checked every picture and think about, would I do it tomorrow the same? Or was it not perfect? Yeah? And before this, I call it after action review. Yeah? It's from the military. After the US military does an operation, they always do an after action review. They look, what was the purpose or what was the goal? Did we achieve the goal? Yes or no? And what can we do the next time better? And after every surgery, I mentally check this after action review, and I try to implement this after action also with our younger clinicians. So we sit together after a surgery and think, was it perfect? Was it not perfect? What can we do better? Mm-hmm. And only with
constant improvement.
Mm-hmm. Constant and never-ending improvement. Mm-hmm. Lifelong journey.
So now I like this, that you prioritize the smartest question, not the hierarchy. I think that that's a great philosophy. This could drive a lot of creativity, but creativity does not finish projects. But we know you guys, and because we do a lot of studies with you guys, clinical studies, really difficult and important clinical studies. And we know also that the department is very performant and very good in the execution. So how do you manage this one then?
Yeah, I think that's about leadership. Yeah, leadership sounds fancy, but at the end, leadership begins with yourself. Yeah, you have to be an inspiring leader to have inspiring colleagues. Yeah, so I think it starts from the top. You have to live the lifestyle or the business lifestyle you want to have in your department. Mm-hmm. If you are not there, if you are traveling all the time or doing crazy, not effective stuff, probably your clinicians will do the same. So at the beginning, it starts with yourself. So start with yourself. Just tell you or ask you the right questions, and if you answer these questions smart and effectively, I think running a business or running a department is no rocket science. Mm-hmm. You don't have to be the inspiring Steve Jobs. Everybody thinks about, when he talks about leaders, about Steve Jobs, and then everybody gets, scared. I'm not Steve Jobs. I'm not Steve Jobs too. But we don't have to be Steve Jobs. Mm-hmm. We just have to implement a system. Where do we want to go? Where we can achieve it? How can we achieve it? And then you have to build up systems. It's not about the leader who gives every day a motivational speech. Come on, we are the best. No, that's not about. It's about systems. You have to have checklists before going into a surgery. Not just doing it freestyle, but thinking before you go into the surgery. Did I do the right diagnosis? Did I ask the patient if he take any medications? We started the holistic mindset. So checklists before you go into the surgery, checklists during surgery. When I do a surgery, I have a complete workflow how I perform the surgery. Always a plan A. Then, if plan A doesn't work for whatever kind of reason, I have plan B already in my mind, and plan C and plan D. So I never, but get kind of nervous in a surgery. For me, it's always focus. It's about visualization. And then, already how I told, after action review. So if you live this lifestyle, this checking at the beginning, having a straight workflow, doing an after-action review. If you live it, I think your clinicians will follow. And then your department or your private practice has no limits.
Okay, cool. Let's spend a word also on the ITI, because you're very active in Germany, but also on a global scale now as a mentor for the young leaders. Why did you engage in the ITI, and what kind of a community do you want to help building? Because you are very active in also shaping the ITI.
Yeah, for me, the ITI is not just a society. It's more a think tank, or a hub for achieving excellence in implant dentistry. So it's not about coming together and chit-chat. It's about curiosity, how you mentioned. It's about growth. It's about, at the end, happiness. Yeah. And in the ITI, there are so many inspiring people. If I go to an ITI Congress, I can approach every person there and learn something. Yeah. And at the ITI, there are, in a percentage, the most inspiring people. Yeah. Therefore, I love the ITI from the bottom of the heart, and I want to be part of it, and I want to give my best to shape this society, yeah? To, at the end, get better patients treatment all over the world. Yeah? This is the beauty about the ITI, it's international. So we can reach with our things we are doing at the ITI, not only Germany, we can go to Africa, we can go to Asia, and where billions of people are living. So with the ITI, we can create an incredible impact. And therefore, I love the ITI from the bottom of my dentistry heart.
I also have then that's the last question probably to your, let's say, education and influencer journey. And then we go more to clinical topics and the future of the industry. You're also running a podcast,
Yeah.
Eik, for the DGI in Germany. It's called Knowledge to Go, if we translate it into English. How do you see this? So why did you come up with it, and how do you see the place? What is the place of a podcast format in today's learner world?
I think it's getting a big pillar inside the learning market because it democratizes knowledge. Yeah? This podcast we are here microscoping today will be heard all around the world. 8 billion people have the opportunity to hear this stuff we are talking about. Yeah? It's democracy at its best. Yeah? And the important thing, it's snackable and portable. Yeah? You can hear it doing sports, you can hear it between surgeries, you can hear it everywhere on the planet. Yeah? And this is the beauty of this format. Yeah? Of course, it has its disadvantages. You can't show slides, and in some cases, especially clinical topics, it's better to have also a visual learning. Yeah? That's the disadvantage. But for this democracy thinking, I think podcasts are coming to stay. Yeah, they have a big future.
What makes a great podcast episode for you?
Yeah, I think
I will try to get some tips, George.
Exactly.
Yeah, at the end, I think you have to have an authentic discussion. Yeah, it's like a backstage discussion. Yeah, the people want to hear the person behind the script. Getting knowledge about why is Professor Buser, what he is doing? Why is Professor Istvan Urban so successful? Yeah? We want to understand the person, and I think this is the podcast format is optimal to have this short look behind the scenes. Mm-hmm. Yeah? Because on a lecture you see the superstar on the lecture, he's showing his best cases, and there is a great distance between you and the lecturer. On a podcast, you think, okay, personal. He's just sitting next to you, and you have a chit chat at the breakfast.
Yeah, and you don't see the journey and the work behind.
Absolutely, yeah.
All the successes.
You are totally right.
Yes.
Yeah.
No, thanks for sharing, Eik. So, yeah, let's move a bit more on the clinical topic.
Exactly, Eik. So let's dive into one of your passions, implantology, and particularly also digital implantology. And here, maybe let's start with the question, where do you see the biggest shifts in implantology happening right now?
Yeah, everybody is talking about AI. Yeah, of course, this is a big topic. But I think this AI topic is more in the diagnostic and treatment perspective. Yeah? I don't see robots overtaking our job as a surgeon. Yeah? It's too complicated. It will take a lot of time to have really robots doing the surgery. So you as a surgeon, you have a safe job for the next 10, 20, perhaps probably 30 years. Yeah? I see the big changes in a more holistic planning and a holistic treatment planning. So for me, the future is that the patient is coming to our clinic. He gets diagnosis, full diagnosing, a scan, and hopefully soon, X-ray diagnosis without radiation. So I think the MRT, at the moment, it's not so far like the CBCT, but I hope that the MRT without radiation has a big future. So then we can get every patient just walking in our clinic, having a scan, having a MRT, then get the full patient, get an analysis, and then the AI gives us the different treatment options. Go we for ortho? Go we for classical prosthos? Go we for implant surgery? Do we need a bone augmentation? And there the AI helps us enormously because he has a broader mindset. As a surgeon, you are always single-minded to the implant, but that's not in the perspective of the patient. I think the whole patient journey, the patient perspective is getting more in focus with the AI because it helps to give us advice how to treat the patient. And at the end, of course, it's about money. If you do orthodontic treatment, it takes time, it costs more money. The patient has to decide, am I willing to invest this money or the time, or go I just straight for the implant? It's a decision-making progress. The AI helps us, but especially for complex treatment decisions, we as a clinician are still helpful to get the emotions behind, because the AI I don't think can get the emotions of the patients perfectly. So in the future, we have better diagnosis planning and decision making. The surgery behind this diagnosis and treatment planning stays probably nearly the same. We have tools which help us, like guided workflow, dynamic navigation, static navigation, but I don't see there the big changes. I see it more on the diagnostic part.
To build on this, and it's very fascinating that you see there also the biggest changes happening. Now, if I listen to you, there will be superhuman performance of AI, particularly in diagnostics, and it's there already for some fields. Now, will this change also the private practice versus university clinic importance? Because at the university clinic you have a multidisciplinary team that can actually come together and also discuss a patient case. Now, will AI make private practices even more closer coming to providing that holistic service thanks to AI?
At the end, university and private practice is sitting in the same boat. So we have the same goal. And the future of the university is to be the specialist clinic for the very, very complex cases. At the university, you have intensive care, so they can do the big tumor surgeries. If a university has to place an implant, because the cost structure at the university is 10 times higher than at the private practice. I think we can create a win-win situation. And the big hospitals, the university should very prioritize on the challenging cases, and the persons in the private practice should do the not so complex cases, because it's much more efficient. And if we get this mindset together, it's difficult because everybody thinks he can do the best. But at the end, we have to get a step back, think what can we do best in the private practice. It's the straightforward cases, easy workflow, small costs for the patient and the system in whole, and complex cases to the university.
Perfect segue. So complex cases, you drive a lot on complex rehabilitation, building up hard and soft tissues, and this augmentation cases that you're doing, it's quite fascinating also, particularly with CAD/CAM meshes, and we'll come to this. Talking about your learning journey, it was not easy probably to get there. I mean, those are very difficult cases. What were your moments where you actually, learned most? Maybe procedures that you tried and now you had to abandon because you learned that actually they were not the best.
Beautiful question. When I started my career, it were all about block augmentation procedures. We started with the autologous blocks, and they had good results. Then there came these CAD/CAM allogenic blocks, and we were used to the autologous blocks. So, wow, individualized techniques and beautiful CAD/CAM allogenic blocks. These are the futures. I really dived deep into it. And if I see my results years later, I see that block augmentation procedures have not the result I would wish for my patients. Yeah, because the vascularization, the bone regeneration in blocks, regardless of it's autologous or allogenic, is not so sufficient because there are cortical parts and they don't vascularize. So we see today a clear trend to going to particulate techniques. So we did nice things with blocks, but today I don't do blocks anymore. I'm in the game of particulate techniques. There are different techniques we can discuss for hours. Yeah, there are pro and cons for every technique. But after action review, after 20 years of implant dentistry, I would start quite faster with particulate techniques than with block techniques.
And you perfected this particulate technique quite a bit. So you have a specific ratio of autologous and xenogenic particulate grafts that you're using, 70-30 if I'm not mistaken. Maybe let's dive a little bit more into this. How do you take the decision when you see a patient with a large defect that you would actually go for digitally enhanced, maybe patient-specific mesh, and when can you stay with normal augmentation procedures?
Super. When we talk about digital bone regeneration, we always have to say it's an individualized approach. It's not a fashion. So we don't use digital techniques just for the sake of using digital techniques. At the end, we have a patient and we want to have the best treatment outcome. When we talk about complex bone augmentation procedures, we have to respect the biological principles. How does the bone regeneration works? And at the end, we need time. Yeah. At least 3 to 4 months if we go only with autologous bone. If we use bone substitute, probably we need more than 6 months. Yeah? So we need time. We need vascularization and we need a stable scaffold. That's very important. Yeah? If we think about a bone regeneration, how does it work? A small vessel is growing from the local regional bone inside our graft. A very, very small vessel you can nearly see in the microscope. And this vessel brings not only vascularization, it brings stem cells. So progenitor cells who can develop into osteoblasts. And if you have movement in your bone augmentation, this small vessel gets crushed. Yeah, it's like an earthquake for this small vessel. You don't have sufficient bone regeneration. You have, as the Americans call it, mushy Gewebe. Yeah, mushy tissue. Yeah? And this is not sufficient bone regeneration. So we need a stable scaffold. And now there are different techniques to achieve a stable scaffold in complex bone augmentation procedures. In minor defects, we have the GBR. There, the classical collagen membrane is sufficient enough to get stability of your particles because the defect is self-containing. In complex defect, it's a non-self-containing defect. So you have to have a graft that stabilizes your particulate techniques.
So you need to create this stabilization that otherwise would be given by the 1 to 3 wall defect that simplifies that.
Absolutely. And there are many ways to roam. And you can ask several clinicians and everybody says he has the best technique. At the end, it's all lies.
It's all lies. Okay.
It's all lies because you can be successful with every technique. We have the shell technique, autologous or allogenic shell technique. Beautiful technique, but it's a learning curve. Yeah, it's not a no-brainer. You have to be a very used clinician to position these shells in a correct position and don't get the dehiscence. Yeah, shell technique. We have the mesh techniques. Yeah, nowadays CAD/CAM mesh techniques. It's easier to create the scaffold compared to the shell technique. Yeah. But you have the disadvantage that the mesh has to be taken out after the 6 months of bone regeneration. Yeah? Then you have the East Van Urban technique or the Gore-Tex membranes. They are more stable than a classical collagen membrane, but they have the same goal, just to create a stable scaffold. The disadvantage about the Gore-Tex membrane is that you have no connection between the Gore-Tex and your soft tissues. So soft tissue management is very, 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 very crucial, and you have to be a top clinician to have success in complex augmentation procedures with the Gore-Tex technique. So every technique has its advantages.
Pros and cons, yeah. And you need to know how to apply it. Now, obviously, you chose the CAD/CAM technique also to be trained to other clinicians, younger clinicians. Why is that so? So out of all of these techniques, what makes that one for you the most teachable or the one that actually has a lot of potential?
we have to stay cautious. Of course, you see on lectures most of the time the big cases. I'm coming from a university setting. We have a lot of tumor patient or a big trauma patient with huge defects. The CAD/CAM mesh is not my choice, my favorite choice for easy defects.
Sure.
I only choose CAD/CAM mesh if we have a vertical component of the defect and if we have a C curvature of our defect. The straight vertical defect, I go for shell technique, but in the frontal region, if we have the C curvature, it's very, very hard to set your shells in the right position that you get the curve of your jaw. There it's much easier to go for a CAD/CAM mesh. So CAD/CAM mesh, favorite choice, vertical defects with a C curvature.
Yeah.
Every other vertical defect, I go for shell technique or the Gore-Tex membrane. At the end, I don't decide it, my patient decides. I tell them the pros and cons, and then in a common discussion, we choose the right approach for the patient. But there is not the augmentation technique. There are different techniques with pros and cons.
Differentiated way of looking at it, very important. Are there any biomaterials, Eik, biomaterials or also augmentation procedures that you think are undervalued today and that should be researched more?
Absolutely. I think especially in Germany and Europe, the allogenic bone has a bad reputation and is not used very often. Allogenic bone is very common in the United States, but in Germany, it's a niche product. And the problem is that we had a big Tutoplast scandal 20 years ago where allogenic bone was bought by a company from very, very difficult origin. That's not the case anymore. The scientific evidence is absolutely clear for allogenic bone. It's 100% safe, it's very predictable, and you have very nice outcomes, and you have less morbidity compared to the autologous bone. So I use allogenic bone very, very often, and we have great long-term results. But in Germany, it's a mindset problem. We are working on this mindset problem to get these crucial mindset about the bad thing about allogenic bone out of the colleagues' minds, but it's a long journey. But in future times, I see the allogenic bone much more coming up, even in Germany.
Staying a bit with the future, and if there would be, a Christmas wish, what would you actually wish that we will bring to the market or the industry in a broader scale?
Yeah, I think you as Straumann, you are the global leader. So you have a great opportunity, but also a great responsibility, not just to respond to the market, but to shape it. You have the opportunity to really get implant dentistry in the next century or in the next development. And I think we should not think about products. We should think about the patient journey. I already mentioned that we get a holistic approach. I see the companies helping us to get a very streamlined workflow in the clinical setting, to make implant dentistry more social. At the moment, it's very expensive. But with the clinical digital tools, we can get implant dentistry much more cost effective, less expensive. For example, the ProArch cases. In a ProArch case, the final prosthose is very expensive for the patient. But with the new digital techniques, we can go for the fully digital workflow. So go very smart and very time efficient in a surgery, and then put just the CAD/CAM provisional just after surgery inside the patient. And this CAD/CAM provisional costs from the material side €5, €6, and it could stay there. And if it breaks after 3 or 4 years, we just print for €3 a new one. I think that's your homework as a company to think about the patient journey. How can we get implant dentistry wider into the market? How can we improve the patient journey from the beginning to the end? And Andreas, you are talking a lot about patient's journey, and you are already making a lot of thoughts about this concept, but there is still a lot of improvement. The follow-up, You have started a registry. I love your registry because it's about feedback. Yeah? We place a lot of implants and nobody cares about the success rates. Yeah? Nobody stays humble and thinks, was I really successful after 10 years?
It's the ultimate debrief that you talked about before. So,
absolutely. So I think this is from the planning, the first approach, perhaps also marketing. Yeah, how do I get the patient inside my clinic? Yeah, perhaps you can help us too as a company to get the right patient, the A patients we want to have, then the complete journey, and then the follow up. If you help us as a company to get this whole journey implemented in a smart workflow in our private practice, you will stay the number one.
Also democratizing implantology to a certain degree.
Yeah, absolutely.
Maybe last question. You are a very visionary person, a very passionate person. What is your vision of dental implantology in 10 years from now? You know, how will you run your private practice? What patients will you see, and what biggest changes will you hope that actually materialized?
Yeah. I hope that we will be more minimally invasive. I don't talk about flapless surgery, absolutely not. I talk about immediacy concepts. I'm the biggest fan of immediacy concept because the patient absolutely has a benefit of it. Yeah? He only has one surgery, tooth out, implant in, ready to go. Classical concept, tooth extraction, implant placement, and then second stage surgery. These are 3 appointments according to 1. And we have to think about ecology. Yeah, the carbon footprint. Coming patient 3 times in your private practice with the follow-ups, or just coming 1 time, it has a huge holistic impact on our environment. Yeah? We have to also respect this to be more sustainable. Yeah, so I think about minimal invasive surgery, getting less morbidity to our patient, less clinical appointments, less carbon footprint. We can talk about short implants. I think they are still in a niche, but do we really need all these vertical augmentation procedures? Yeah? Can we just go for short implants or the new trend, cut-cam implants? Yeah? We can design beautiful implants where we don't need any bone augmentation procedure. Yeah? I think there is the future about. Of course, we already discussed the AI thing. I see it more on the diagnostic part. Me as a surgeon, I think I will be more like a pilot. Yeah, have my check-up briefing at the beginning of my flight or my surgery with all the AI. Then I have digital tools who helps me to perform my surgery, but I'm still doing it on my own, hopefully. But I'm quite sure. And then the debriefing is again with checklists, with AI helping me to do the follow-up better, so that the AI probably calls my patient the day after surgery, that I don't have to call it myself, that the AI calls the patient, has everything fine with you? Do you have pain? Yeah, this would help me a lot because I try to phone every patient the day after surgery. This is a pain in my schedule, but I want to have this personal contact and hope and want to see the result. And if would AI help me to do this,
it would be more time for
half an hour to 1 hour less, more time for different other 5 pillars stuff.
Great.
Well, thanks a lot for sharing and for answering a lot of questions. Very unusual for you that you have to answer questions. Usually you ask the questions. So that there's also space in our podcast for you asking a question that you always wanted to ask your industry partner or us, Eik.
Yeah, I'm a fan of Straumann. I'm honest because you have a great culture. I'm working with a lot of different people from different hierarchies with Straumann, and I see always A people, A players. So smart people and humble people. It's a combination I like very much, when people are smart and stay humble. And I think it's about your mindset in your company. And I've learned that's the player-learner mindset. I love this word. I learned from you. But personal for you, Andreas, for you, George, what is the player-learner mindset for you?
That's a big question. Do you want to go? Or?
I can start, and it aligns very much with what you also shared from your mindset. So it's this, you need to stay open for new input, because otherwise you're getting into this nowhere spiral. So you're listening to people that are confirming your views, and with this you're actually generating a closed mindset. And if you want to break this cycle, then you need to find people that actually provide you challenging questions as you formulated it, or also giving you very honest and clear feedback. And we try to surround ourselves with those challenger personalities. And to me, this has been not only a huge learning for the, I would say, business setting, but also for the private setting. So I learned from my entire life based on this cultural journey. And we call it player learner. There is, let's say, a whole, I would say, set of activities that we, from top to bottom, everyone at the company goes through. And by this, we also get a common vocabulary and common understanding of how we want to interact with each other. So this being able to fail component that you also mentioned is, for example, particularly for R&D, extremely important. I mean, you cannot do research without the mandate to fail. Yeah. Actually, I tell my people, if you're never making a mistake, you will not be successful. You cannot advance the field if you're not pushing the boundaries. And pushing the boundaries means that things do not go according to plan, because according to plan means you could predict what the outcome is. So you already knew. How do you create additional know-how without failing? And this is at the core of what we're doing. And it makes, I would say, the entire work with our company is so much more rewarding for the individuals, because they can go on their own individual learning journey, and we encourage them to try to make those mistakes. Now, of course, it's about learning from these mistakes afterwards, because otherwise it's just a failure. And I think cultivating this mindset has been tremendously important for me personally, for our teams at R&D, and of course also, I would say, the entire company, because I believe that this is one of the big strengths that we're having, that it's not just about the immediate reward tomorrow. It's about the longer journey, and it's fascinating to be in a field where there is so much open questions still existing, and we can really move things. So this is something that motivates and inspires people. So the whole culture thing is extremely important, I think, also for the success of the company.
And I would add that it's not always been like this. We had situations in this company, and George and myself, we are both more than 20 years in the company, where we've not been so successful because we thought we know. We had a tissue level implant, and we were convinced this is the best implant. And then we broke the paradigm, and we brought the bone level, and we realized, it was good to break the paradigm and to open this door. And then we broke the paradigm to immediacy, which was not favored in the company, and also with the ITI not. And we realized it was an important move. The BLX was an important move. So whenever we opened our mind and we tried new things, we realized it made us more successful. And I think this is just really fostering curiosity and openness, because we realized this openness was very important for us to be successful. And I think this is also what Marco Gardola did in his time when he was the CEO, and also Guillaume, what he is doing at the moment. And then the last word, it's actually two things, player learner, and you mentioned this humbleness. And I really want to underline this. I think we have people in all hierarchies who are genuinely interested in what you guys are doing. I'm really interested in what you do, and you can speak still to our CEO. You can have any conversation about any technique, product. He's still in the details. We are not managing the company in a helicopter view, but we try to be very close and try to be very humble and to be honest. People that are coming to us as an organization that are not humble and not close to the clinicians, that they don't have a long history in this company. It's not the company you want to be in, because we are all very humble and hands-on, I think. And this is what we appreciate. I think it makes it a very special place to be. Yes. So
super.
Great question. So thanks a lot, Eik. Thanks for sharing a lot of interesting insights, your recipe to success, the 5 Fs. And I was impressed about how mindfully you work on your purpose, the why, your life, and how deep you are in all the topics that you do. I mean, if you do something, you really do it right.
I try to.
And that was very impressive. So thanks for sharing all of this.
Thanks
It was great to have you. And for all of our listeners, look out for the next episode. One of the guests we are going to have is Bilal Al-Navas, your dear mentor. He's already scheduled, so he's going to be one of the next episodes. So thanks a lot. If you want to share feedback, please do so on all the podcasts platforms. And if you want to ask questions, please also watch out for the next episodes. We always ask for questions in our Instagram channel. So thanks a lot for listening in.